So this video is a watch for everyone. If you know you want to do kidney transplant, you need to watch this video. Especially if the cause of your kidney failure is as a result of uncontrolled diabetes or uncontrolled sugar level, you need to pay attention. You need to pay attention to this video. It will do you a lot of benefit if you could watch this video to the end. Fact remains that kidney transplant remains the only option of renal replacement therapy that has overall benefits over others, over the peritoneal dialysis, over the hemodialysis. But however, it is not everyone that is a good candidate for this procedure. So in order not to waste resources, in order not to waste the precious organ which is the kidney, then I am making this video so that you will be guided, especially if you have diabetes. If the known cause of your kidney failure is as a result of uncontrolled sugar level, you really need to really pay attention to this video. Of course, we know that after a successful kidney transplant, the newly kidney can take over the functions of the kidneys. It can remove waste, it can remove excess fluid, it can secrete hormones, hormones such as renin hormone, erythropoietin, that can boost the blood volume in our system. But it is not everyone that can actually sustain the care of this kidney after the surgery. And the success of kidney transplant is not just limited to surgical procedure. It is after the surgical procedure. We call it post-transplant care. And that is what matters. That is what is important. You cannot just waste your resources, your effort for a procedure that just lasted for 5 hours, 6 hours, and at the end of the day, this new kidney cannot be sustained for 2 years. That is a lot of waste, and this should actually be concealed. So if you have diabetes and you know that the cause, and this is why you have kidney failure, move forward. Let us get something clear. You know that it is the pancreas that produce the insulin that helps in the uptake of the glucose in our body. And when this pancreas is no longer producing enough of insulin, then there is problem. And at the end of the day, if this no or low production of insulin cause kidney damage, then we cannot totally ignore the cause of this kidney failure. Going for kidney transplant is just a way of repairing what was damaged due to a cause of something. And if you repair what was just damaged and you ignore what caused this damage, then there is possibility that what damaged the initial kidneys will still end up damaging this new kidney. And that is why I am making this video. If you know that you have kidney failure as a result of diabetes, kidney transplant may not be the best solution for you if you don't have any plans of doing pancreas transplants. If you don't have means or plans of doing pancreas transplant, then you don't need to go for kidney transplant. At the end of the day, kidneys does not produce insulin. And especially if you have type 1 diabetes, I'm sorry to say, but going for you have kidney nephropathy as a result of type 1 diabetes, I'm sorry, but kidney transplant may not actually be of help to you. Of course, you have a successful surgery, but that will not actually last. The graft will not last you for more than 2-3 years. Then it will fail. So please, before you actually go for this procedure, ensure that you have plans of doing your pancreas transplant. Kidney transplant is not for you if you have diabetes, if you have sickle cell. And I think you should be told in the hospital that this may not last longer like normal patients who do not have these diseases. I hope this helps.